Welcome you all on my YouTube channel Avasthi's Ayurved Anatomy, Yoga and Spirituality. Today we are conducting the objective test on heart for entrance examination. Question number 1. The anterior surface of the heart is not formed by option A, right auricle, B, left ventricle, C, left atrium, D, right ventricle, E, right atrium. The best option is C, left atrium. Explanation: the left atrium lies on the posterior of the vertebral aspect and forms the major part of the base of the heart. Question number 2. In the postero-anterior view of a chest radiograph, the left margin of the heart is not formed by A, pulmonary trunk, B, left ventricle, C, superior vena cava, D, left auricle, E, arch of aorta. The best option is C, superior vena cava. The superior vena cava forms the upper part of the right border of the heart shadow. Question number 3. Regarding the conducting system of the heart, choose the erroneous statement from the following. Option A. Atrioventricular bundle is the only pathway for conducting waves of the contraction between the atria and ventricles. B. Sinoatrial node is the site of spontaneous beginning of the impulse for cardiac contraction. C. Sympathetic nerves to the heart slow the rate of the discharge from the sinoatrial node. D. Sinoatrial node is frequently supplied by the right and the left coronary arteries. Option E. The septal cusp of the tricuspid valve lies anterior to the atrioventricular bundle. The best option is C. Sympathetic nerves to the heart slow the rate of the discharge from the sinoatrial node. Explanation: the sympathetic nerves increase the heart rate by increasing the rate of discharge. Question number 4. Which of the following statement concerning the blood supply the heart is not correct? Option A. Left coronary artery supplies both the left atrium and the left ventricle. B. Circumflex branch of the left coronary artery descends in the anterior interventricular groove and passes around the apex of the heart. C. Coronary arteries arises from the ascending aorta. D. Coronary arteries can be classified as functional and arteries. E. Occlusion of the coronary artery or its branches may lead to abnormal heartbeats, cardiac arrhythmia. The best option is B. Circumflex branch of the left coronary artery descends in the anterior interventricular groove and passes around the apex of the heart. Explanation: the circumflex branch runs posteriorly in the left atrioventricular groove and not in the anterior interventricular groove. Question number 5. The normal pacemaker of the heart is the option A. Sinoatrial node, B. Atrioventricular node, C. Atrioventricular bundle, D. Purkinje fibers. The best option is A. Sinoatrial node. The sinoatrial node, located in the upper part of the crista terminalis of the right atrium, is the normal pacemaker of the heart. It generates the electric pulses that are conveyed to the atrioventricular node and bundle. Subsequently, the impulses spread by the Purkinje fibers to the walls of both the ventricles. The electrical impulses so generated result in alternate rhythmic contraction of the atria and the ventricles. Question number 6. The pulmonary valve heart sound is best heard in the option A. Left second intercostal space at the sternal margin, B. Right second intercostal space at the sternal margin, C. Right fifth intercostal space at the sternal margin. D. Left fifth intercostal space 5 cm the sternal margin. The best option is A. Left second intercostal space at the sternal margin. The second or pulmonary valve heart sound is the best heard by auscultation in this left second intercostal space at the sternal margin, this being the site of the least interference for the sound of the wave. The best option is A. Left second intercostal space at the sternal margin. The second or the pulmonary valve heart sound is the best heard by the auscultation in this left second intercostal space at the sternal margin, this being the site of the least interference for the sound of the valve. Option B is the site for auscultation of the aortic valve, while option C is where the tricuspid valve can be best heard, and option D is the site for the apex beat as well as the bicuspid valve sound. Question number 7. Stimulation of the postganglionic sympathetic fibers supplying the heart results in all of the following except A. Cardiac acceleration, B. Increased force of contraction of the cardiac muscle, C. Increased blood pressure, D. Constriction of the coronary arteries. The best option is D. Constriction of the coronary arteries. Stimulation of the sympathetic fibers supplying the heart would result in dilatation and not constriction of the coronary arteries, resulting in increased blood flow to the myocardium to deal the cardiac acceleration. The others are direct effects of the increased sympathetic activities. Question number 8. Concerning blood supply of the heart, which of the following statement are correct? Option A. The left coronary artery gives off the anterior interventricular branch which supplies both the right and left ventricles. Option B. The anterior cardiac vein opens in the left atrium. The best option is option A. The left coronary artery gives off the anterior interventricular branch which supplies both the right and left ventricles. The anterior cardiac vein opens into the right atrium and not the left atrium. Question number 9. Which of the following statements are correct? Option A. The base of the heart is chiefly formed by the left atrium. B. Penetrating wounds of the neck just above the medial 1/3 of the clavicle may puncture the pleural cavity. C. Both statements are correct. The best option is C. Both statements are correct. Thank you for watching my channel. Thank you all.